An inclusive community for all, a guide towards deinstitutionalization of persons with disabilities. The United Nations Committee on the Rights of Persons with Disabilities recently adopted guidelines on the deinstitutionalization, including in emergencies. These guidelines give states guidance on how to ensure that all persons with disabilities, including those in institutional care, are able to live independently. These rights are recognised by Article 19 of the UN Convention on the Rights of Persons with Disabilities.
Odelia Fitoussi, CRPD Committee Rapporteur.
The committee adopted guidelines on deinstitutionalization, including in emergencies. The guidelines supplement the General Comments No. 5, 2017 on living independently and being included in the community, and the guidelines on the rights of persons with disabilities to liberty and security.
Why did the CRPD committee decide to develop these guidelines?
Amalia Gamio, CRPD Committee Vice Chair.
The idea of first forming a working group on the institutionalization began in 2019 because we were already concerned that there was no progress in the processes of the institutionalization.
While accurate data is scarce, throughout the world there are persons with disabilities who are forced to live in institutions of different kinds. According to a 2019 report, in Europe, it is estimated that nearly 1.2 million persons with disabilities live in institutions, without the opportunity to challenge this living arrangement. While there are no reliable aggregated figures in American and Middle Eastern countries, a large number of persons with disabilities remain institutionalized. In Africa and Asia, persons with psychosocial disabilities bear the greatest brunt of institutionalization. Living in an institution for persons with disabilities means they are isolated and segregated from independent life in the community, do not choose with whom they live, do not have control over their day-to-day decisions, are forced to share personal assistance with others and cannot choose who assists them, are subjected to imposed rigid routines and supervised activities regardless of their wishes, are exposed to mistreatment and abuses. In 2020, the COVID-19 pandemic seriously impacted persons with disabilities in institutional care, reminding all of us of the high risks of isolation and segregation in institutions.
Jonas Ruskus, CRPD Committee Vice Chair.
Systems built around particular living arrangements for persons with disabilities became place of full social isolation during the pandemic, and with the full lack of access to mainstream health systems, in fact, became place of the highest risk of death for many people with disabilities who are placed in institutions.
Making every voice count.
Amalia Gamio, CRPD Committee Vice Chair.
The elaboration process was historic, first of all because strictly based on the mandatory nature of Article 4.3, we established a consultation in 7 regions of the world, listening to the concerns and proposals of persons with psychosocial and intellectual disabilities.
Jose Maria Vieira, Advocacy Director, International Disability Alliance.
The participation of persons with disabilities and their representative organization, especially survivors of institutions, have played a key role in the development of these guidelines. IDA, along with the partners of the Global Coalition on Deinstitutionalization, have successfully contributed to the CRPD committee in the development of these guidelines.
Several organisations created the Global Coalition on Deinstitutionalization in 2021 to support the process of the CRPD committee. These include International Disability Alliance, Inclusion International, Transforming Communities for Inclusion, the European Network on Independent Living, Disability Rights International, Disability Rights Unit at the Centre for Human Rights, Disability Rights Fund, and the Disability Rights Advocacy Fund, the Validity Foundation. Why are these guidelines important?
Jose Maria Vieira, Advocacy Director, International Disability Alliance.
The new guidelines complement the previous work done by the CRPD committee and make concrete recommendations to member states. We call member states for a high-level political leadership and cross-ministerial implementation of the guidelines to secure a successful deinstitutionalization process. We call member states to ensure persons with disabilities lead the process of deinstitutionalization and that no one who benefit or profit from practice of institutions can participate. Ensure that persons with disabilities are not required to accept specific living arrangement, such as living in institution or institutional care, to access support services. Due to the impact of COVID-19 pandemic, the guidelines also calls for accelerated efforts to ensure deinstitutionalization and the close of all institutions, even in emergency situations.
The 2020 report of the COVID-19 Disability Rights Monitor gathered testimonies from many countries and demonstrated that governments around the world have failed to protect the right to life and to physical integrity of persons with disabilities in institutions during the pandemic.
Jonas Ruskus, CRPD Committee Vice Chair.
In emergency situations, residential care institutions, particular living arrangements become place unsafe, dangerous, and with high risk of death for persons with disabilities due to the abandonment or violence.
States parties should ensure that intersectionality is considered throughout all aspects of deinstitutionalization processes, while employing gender-sensitive and age-appropriate approaches. States parties should also tackle structural racism to prevent discrimination and institutionalization based on race and ethnic origin in conjunction with disability.
Dragana Sivic-Milavonovic, Disability Rights International.
The UN guidelines on deinstitutionalization contribute to the advancement of the rights of children with disabilities, and they do present a progressive approach and are more conducive to the rights of children with disabilities compared to prior existing standards on the rights of the child.
Breathing life into the guidelines at a national level.
Yeni Rosa Damayanti, Chair of Indonesian Mental Health Association.
The guideline can be useful for our advocacy, especially at the national level, because the forefront of the advocacy for the institutionalization is the DPOs at the national level.
Jose Maria Vieira, Advocacy Director, International Disability Alliance.
The CRPD committee with these guidelines is proposing a roadmap to ensure that persons with disabilities get back the right to live independently and being included in the community as is established in the CRPD Convention. National governments and international cooperation agencies have a role to play. They can help in implementing these guidelines by reallocating resources and efforts to ensure that support services and the right to live independently and being included in the community can be fulfilled. It's paramount that all persons with disabilities are afforded to live with dignity and autonomy.
Robert Martin, CRPD Committee Member.
We cannot accept institutionalisation anymore. I hope state parties use these guidelines to bring people together and move forward with deinstitutionalisation and make our communities inclusive of all people with disabilities in line with the CRPD.
International Disability Alliance. This project is supported by the Disability Rights Fund.